We're not 100% sure how immunodeficiency works. It may be caused by inherited defects that affect the immune system development, or it may be due to secondary effects of other diseases, such as infections, malnutrition, aging, or even immunosuppressant drugs. And there are two types, either primary, which is congenital, or acquired. Patients with immunodeficiency also have an increased susceptibility to infections and certain forms of cancer. So, the inherited primary version is what the majority of immunodeficiencies are. They're mainly diagnosed in children under the age of 1, although milder forms may not be recognised until later adulthood. And they likely present as reoccurring infections, as well as due to dysfunction or a decreased number of immune cells, antibodies, or immune system regulating mechanisms. Examples include SID, which is severe combined immunodeficiency, and leukocyte adhesion deficiency. The second type, which is acquired, results from a secondary or environmental factor, so is not genetic. And various immunosuppressive factors may be responsible, for example, malnutrition, aging, and particular medications such as chemotherapy, disease-modifying anti-rheumatoid drugs, and immunosuppressive drugs that you take after organ transplant. There are also many other specific diseases that may directly or indirectly cause immunosuppression, such as cancer, specifically those with bone marrow or blood cancer. So, as I mentioned, one sort of immunosuppressant disorder is AIDS, which is the acquired immunodeficiency syndrome, and this is caused by the human immunodeficiency virus, or HIV. It interferes with the immune system and makes sufferers more susceptible to infections such as TB. Over 36.9 million people are infected with HIV worldwide, and in 2014 there was a reported 12.2 million deaths. And altogether since its identification there have been 39 million deaths. The majority of cases and deaths occur within sub-Saharan Africa. And although it is associated a lot more with homosexuality, there was actually heterosexual transmission accounted for 40% of cases in 2014. So there are a few ways that the virus can be transmitted. The first one being the one that you're probably aware of, and that is through sexual contact. The other one is just significant exposure to infected bodily tissues and fluids. Another one is vertical transmission from mother to child. Exposure to infected tissue or fluids such as blood, not feces or mucus unless it is contaminated with blood. So what actually is HIV? HIV is a retrovirus that primarily infects CD4 plus T lymphocytes, macrophages, and dendritic cells. It directly and indirectly destroys the CD4 plus T cells. And it's not just the virus itself that causes death, it's the fact that this virus is weakening the immune system, making it more susceptible to other diseases that causes the deaths. There are 3 stages of infection, the first being viral entry into the cell. So the viral protein binds with CD4 and chemokine receptors on the host T cells. When it enters the cell, it undergoes viral replication and integrates the virus genome into the host cell's DNA. And then there's progressive infection, so there can be infection of more dendritic cells, infection of cells in the lymphoid tissue, and continual viral replication leading to progressive loss of CD4 plus T cells, which weakens the immune system. There are a few different therapies that you can undergo to help with HIV. There is no cure, but there is a way to sort of prolong life and reduce symptoms. So antiretroviral therapy is recommended for anyone and everyone infected with HIV. It can't cure it, but again, it helps people live longer and healthier lives, and it also reduces the risk of HIV transmission. This is because it prevents HIV from multiplying, which reduces the amount of HIV in the body. Having less HIV gives the immune system an opportunity to recover if it's been infected by another virus. So even though HIV is still in the body, the immune system's slightly stronger, and it's strong enough to fight off other infections and certain HIV-related cancers. Also, because there's less HIV in the body, it means there's less risk of HIV transmission. Another type is PrEP drugs. These are pre-exposure prophylaxis, which lower the chance of infections. They can be taken orally daily to reduce the risk of getting HIV from sex by more than 90%, or they can be injected and reduce the risk by 70%.